All right, so the topic today, healthcare reform, Affordable Care Act, Obamacare, however you like to refer to it. The focus for today is going to be on how it impacts employers. Healthcare reform affects so many different people in so many different ways. There's a lot of different perspectives that you could come at it from. But today we're focusing on how it affects employers, because I think that's why all of you are here, is to see how it's going to impact your business. In order to do that and give you the full picture, I'm going to get into a little bit about how it affects individuals and what individuals need to do. But for the most part, we're going to focus on how it impacts employers. So here's how I want to go through it today. I want to start with kind of an overview of where things stand today with healthcare reform. If you've been following the popular press over the last several months, you might think that the whole thing has come to a grinding halt, that they've changed everything, that they've delayed everything. And the reality is there have been a number of significant delays, but the reality is the vast majority of healthcare reform is marching forward as planned. There's been some glitches, but most of it is marching forward as planned. And I want to give kind of an overview of where things stand today before we really get into the nitty-gritty. And that, of course, is the employer mandate. That's the biggest piece of healthcare reform that is likely to impact your business, having to either provide coverage to your employees or to pay a penalty. So that's really the main event today. And we're going to dig into the weeds and talk about the mechanics of it, because I want everybody to leave here today with a good grounding in how it works so that you can go back and figure out how it might affect your business. Now, for those of you who know a little bit about the mandate, you probably already know that it applies to employers that have 50 or more full-time employees. So that's a line that we draw in how healthcare reform might impact your business. It would be helpful for me to know, if I could just get a show of hands with the folks in the room, how many of you operate a business or work for a business that has 50 or more employees? Can we get a show of hands? Okay, so we have a fair number of folks in the room. So I'm going to assume everybody else is under that mark. Now I'll tell you, if you're under that 50 mark, you're still going to want to pay pretty close attention to this stuff, because after all, you might approach that 50 mark at some point, and you're going to need to know what are the consequences of it. You know, what kind of additional obligations am I buying into if I grow the business and cross over that 50 mark? So just because you're under the 50 mark, don't assume that you shouldn't have to pay attention to any of this. And I'm also going to offer some thoughts and strategies, if you will, for the folks who are under 50 employees, things that maybe you haven't thought about before. All right, so let's start with where things stand today. If we go back to July of last year, right before the July 4th holiday weekend, employers got the single best piece of news that's come out of healthcare reform since it was enacted back in 2010. And that's when the administration decided to delay the enforcement of the employer mandate an entire year. Had that not occurred, as we sit here today, employers above 50 would have to be offering coverage to their employees or perhaps paying penalties. They'd have this new burden starting this year in 2014. That was the original plan. And I'll tell you, it was quite a shocker when the administration did that delay back in July. I got to tell you, I've been knee-deep in this stuff since 2010 and even before then when it was going through the legislative process, and nobody could have convinced me that the administration would delay the mandate. But what we heard from them back in July is, look, we feel your pain, businesses. We understand that all of this is a really big burden. It's a really big additional cost for you, and we want to give you more time to deal with it, and we want to give ourselves an opportunity to perhaps simplify things for you, to make it a little easier to transition businesses into the employer mandate. So they announced this full-year extension, and so here we are, January of 2014. We now have 11 months to get ready for the employer mandate. So this is a good time to be at a program like this, to start thinking about what you're going to do with your business between now and then. So what happened after that delay? Well, again, if you've been reading the popular press over the last several months, there have been lots of delays and glitches. We had the exchanges open in October. These are the public government-sponsored exchanges where individuals can go get coverage. And I probably don't have to tell you there's been a lot of issues, right? They had the computer problems. They had problems with people being able to pay for the coverage, for people to get confirmation that they've received their coverage, things like that. But I'll tell you that by and large, a lot of those glitches have been smoothed out by now. Anybody who has enough patience and is willing to sit there on the computer and plug through the process, who wants coverage from an insurance exchange, can get it now. You just have to, again, be diligent and go through the process. So by and large, that process has smoothed itself out. Now, the only thing that we've really seen that directly relates to employers since the government delayed the mandate a year is back in September, the IRS issued some initial regulations that addressed the tax reporting requirements for the employer mandate. You can imagine that if IRS is going to have to enforce this brand new tax against employers, they're going to need a lot of information that employers don't currently give them. They need to know how many employees you have, whether or not they're covered, and they need all this information on a monthly basis because the tax is actually metered out month by month. So the statute contemplates a whole new tax reporting cycle related to the employer mandate. So we got the initial rules on that. And I'll tell you, if this was the IRS's opportunity to show us what it means by trying to simplify things, most people were pretty sorely disappointed. What we got from the IRS was something that really didn't have much in the way of simplification. Pretty typical IRS approach to things. So I can tell you, I'm not sitting around holding my breath that the government's going to make this any simpler than it is today. I mean, we might get a few things that will allow businesses to maybe cut a few corners, but by and large, I think this thing is going to remain as complex as we all know it to be today. So the next big event on the horizon for employers is we're waiting for IRS, as we sit here today, to issue final regulations on the employer mandate itself. Everything I'm going to tell you today is out of proposed regulations that are a little over a year old at this point. And so some of the things I'm going to tell you about today may change slightly when IRS comes out with these final regulations. We really won't know until we get them. And as of now, we really don't know when we're going to get them. There have been some rumors that IRS will come out with these new rules at the end of February, maybe early March. In any event, that's the next big event for employers. When those rules come out, you as business owners and employers will have all the tools you need. All the rules will be hammered out so that you can figure out what you're going to do. And by then, you're probably going to have 9 or 10 months to figure it out. So that's the next big event. So there's some questions about what we're going to get in these final rules and how it might impact employers. If we look at what we got from IRS last year, they included a number of what they call transition provisions in the proposed regulations that were intended to ease employers into this new obligation. For example, there was a provision that said, instead of having to look at your employee counts through the whole year to see if you average 50 or more employees, you could pick one 6-month period during the year and use that instead. This was just for the first year. Well, that was a great rule for a lot of employers, particularly employers in this industry, right? Where if you pick the right 6-month period, you might fly yourself under that 50 radar. Kind of depends. So there's a big question, for example, whether that rule is going to stick, whether IRS is going to continue to allow employers during this first year to pick a 6-month period. So we'll have to see. If I had to guess, I would guess we're not going to get that, because that rule, again, was intended to kind of help employers transition in. And when the administration kicked the whole thing out a full year back in July, they sort of gave everybody the ultimate transition provision, right? We're going to give you all a full extra year. But we'll have to see what happens to that. Already talked about simplification and whether we can expect much of that. I'm still hopeful that we'll get some, but again, I wouldn't hold my breath. Now, what's interesting about the delay is it gave Congress, at least at the time, another 18 months to perhaps make some changes to the law. And just recently, we've seen some activity in that area. Some of you are probably familiar with this concept under healthcare reform where full-time employees are employees who work on average 30 or more hours a week. Now, I don't know about you, but most of the employers that I work with on a day-to-day basis don't consider a 30-hour-a-week employee a full-time employee, right? Usually 40 hours, something a little closer to that. And what we've heard recently is there seems to be some bipartisan support for increasing that 30-hour-a-week standard up to 40 hours a week. That would be a huge help for a lot of employers. Now, that's something that would have to be done by legislation. In other words, that 30-hour standard is hardwired into the statute. We can't have the administration or IRS or anyone else, by regulation just decide they're going to move that needle up to 40. We would have to have Congress pass a law to amend the statute. Just yesterday, I was reading about some proposed legislation to do just that is in its early stages. So who knows? We may see some legislation before the year's up that will come out of Congress and perhaps ease the pain a little bit for employers. I don't know about you, but I'm not going to hold my breath that that's going to happen. We've seen how Congress has operated the last couple of years, but we may see something like that. Now, one of the most interesting things to me about the mandate being pushed out a year is something that I don't see a lot of people talking about, or I don't see much written about it either, and that is, how is it going to impact employees? I can tell you that back in July, when the announcement came out, all the clients that I was working with who were gearing up to put coverage in place January of 2014 said, you know what, I'm going to push it out of here. There's really no reason for me to do it any sooner than I have to. Why go through the burden? Why go through the extra cost? So all of those employees who would have otherwise received coverage from their employers starting last month, what do you think they did? Well, a lot of them went out to the insurance exchange and got their coverage there. And so I haven't seen any statistics on this, but I believe that the insurance exchanges were flooded with a whole crop of employees that wouldn't have otherwise been there. So what's going to happen with these employees? Well, most of them are going to get in. They're going to get fairly inexpensive coverage. We're talking mainly about lower wage employees who aren't already getting coverage somewhere else. They're going to get in. They're going to realize, this is great. I get this big tax subsidy. I pay $10 a month, $25 a month, whatever it is. I get coverage from carriers that are frankly the same insurance carriers that are going to be providing the coverage under a plan I might get from my employer. I get to use the same doctor I can use with coverage that I might get from my employer. Hey, this insurance exchange coverage isn't so bad. So then what's going to happen with those folks come January of 2015? Well, January of 2015, their employer is going to step up and do what it needs to do to comply with the mandate. And in many cases, that means the employer is going to make an offer of coverage to these folks that they didn't previously offer coverage to. When the employer does that, that is going to cut these employees out of the tax subsidies they're getting from the government to buy their coverage through the exchange. So you might have an employee who's buying coverage from an exchange that if they paid full price, I don't know, $250, $300 a month, they're paying $25 a month because they get a tax subsidy. When the employer steps in and makes an offer of coverage, they're going to lose that tax subsidy. So they're either going to have to buy the coverage from their employer, which is probably going to be more expensive, or they're going to have to pay full boat at the exchange, which means in many cases the cost of coverage is going to go up 5 to 10 times whatever it is. So it's going to be interesting to see what happens if there's an employee backlash of sorts or some employee relations issues when employers are dutifully doing what healthcare reform wants them to do and to offer coverage, and by doing so it's going to cut all these people out of this exchange coverage that they like, that's cheap. And only time will tell how big of an issue that's going to be, but it is something that I'm concerned about, particularly in an industry like yours where there are a lot of lower wage full-time employees who might not otherwise be getting coverage from their employers and instead have gone to the exchange this year. So we'll see what happens. I think we'll see more written about this as we get towards the end of the year but it's going to be an interesting phenomenon. Any questions on any of that before I move on? Yeah, so the question about the cost of exchange coverage. The way it works when an employee goes into, or any individual goes into an insurance exchange, is they're going to provide information about their income. Last year's income from their tax return, current year's income, sort of so they can project out how much they're going to make. Based upon that information, the exchange is going to estimate what kind of tax credit they'll get towards the cost of coverage. And basically that tax credit is fronted to them. So going back to my example, if the full cost is $250 a month, but somebody's entitled to a $225 a month tax credit, they're only going to have to pay that net amount throughout the year. And then it gets reconciled on the tax return. If it turns out they weren't entitled to the whole amount, it would get reconciled when they file their tax return. But it is basically fronted to them. Yeah, question?
What the income threshold is?
Yeah, so in order to get a tax subsidy for exchange coverage, your income has to be somewhere between 100% and 400% of the poverty level for your size of family. Now, I don't have all the poverty levels memorized, but the one that I do know is the family of four. If you look at a family of four, 400% of the poverty level is just over $94,000 a year. So to put it in perspective, you could have somebody with a family of four who's making $75,000, $80,000 a year in household income, not your typical government welfare recipient, if you will, who will be entitled to an exchange subsidy to buy coverage from the exchange. Now, they're not going to pay $25 a month. It's a sliding scale. So the guy that I'm talking about that might pay $25 a month and get that heavy subsidy is probably somebody who's much closer to 125, 150% of the poverty level, and then it's a sliding scale up from there. But it's capped out so that nobody would ever pay more than 9.5% of their household income as long as you're up through that 400% of the poverty level. So you kind of back into how much somebody might spend, and that's how the tax credit works. Okay, let's move on. So we talked about the delay of the mandate. I want to just give a sort of a quick overview of all the other stuff that isn't related to the mandate that is marching on as forward, not delayed or changed in any way, that does impact employers. And just to be clear, this is the type of stuff that impacts all employers regardless of size. Okay, that 50 or more threshold is for the employer mandate, which we'll get to next. But this is the other stuff that really doesn't matter how big the employer is. It's going to affect any employer, particularly employers that do offer plans to their employees. So let's start with the individual mandate. It's one of the linchpins of healthcare reform. That is marching forward as planned starting this year. So starting this year, every individual in the United States, which is every citizen, every person who is lawfully present in the U.S., which is going to include an H-2A guest worker, every individual in the U.S. is required to maintain coverage during 2014. If they don't, they'll pay a penalty. That's the stick, if you will. It's trying to encourage people to go out and get coverage. Now, the penalty starts out fairly low in the grand scheme of things this year. It's $95 or, if greater, 1% of household income above the tax return filing threshold. So it's a fairly low penalty, and you can rest assured that there are lots of young, healthy folks that are going to be happy to pay that $95 penalty instead of spending several $100s a month, perhaps, for insurance coverage that they don't think they need. So there's, of course, there's a big question. Is that penalty going to be enough to really push the young, healthy folks into the system? And that's who we need in the system to kind of balance everything out. But remember that the individual mandate penalty ratchets up pretty quickly. By the time we get to 2016, 2 years in, the penalty is $695 a head, or if greater, 2.5% of income above the filing threshold. So by the time we get to 2016, we're starting to talk about real money, no matter how you slice it. No matter how young and healthy you are, you might just pay $100 a month, $150 a month, whatever it comes to buy health insurance coverage, because at least you're getting something for your money rather than paying $695 in a tax or 2.5% of your income. So while that penalty starts out low, I think certainly as we roll out into the future, it's going to be a real incentive for individuals to maintain insurance coverage. So the individual mandate, effective as planned, starting this year. Question?
How is that penalty going to be paid?
How's the penalty being paid? Great question. It's paid when somebody files their tax return.
The employer isn't going to get stuck trying to collect it?
No, the employer has no part in enforcing or collecting the individual mandate penalty. That's between the individual and IRS. So of course the first question somebody asks is, well, if they're going to pay it on their tax return, that means they'd actually have to file a tax return in order to pay that penalty, which, point well taken. There's a lot of folks that don't file their tax returns, but that's how it's going to be enforced. Is there'll be a couple new boxes on the 1040 that you'll check off. You know, yes, I had coverage. No, I didn't. And if it's no, then it'll calculate a penalty that'll end up dropping down to the bottom. But it's got, again, between the IRS and the individual. Question? Yeah, the question is there an age for this obligation? No, it's everyone. So babies born, babies expected to have coverage, children. Remember that the tax is assessed on a household level. So in theory, if everybody files a tax return, every individual is going to be accounted for somewhere on a tax return, including that newborn. And so that's how they keep track of it. But yeah, every person counts, basically. Any other questions on that before I move on? One more?
I don't know anyone else from Massachusetts, but going back to what you had asked, the health insurance that, if you're covered, sends you a tax notice that has to be filed with your tax return proving you had health coverage from a particular
Yeah, that's in Massachusetts, right? Yeah, and that's the way it's going to work, similar everywhere, but not until 2015. Yeah, in other words, the health insurance carrier is going to send you the equivalent of like a W-2 that says, yes, you were covered, attach it to your return. But that's not going to happen this year outside of Massachusetts. All right, so let's move on. So we have the individual mandate. We have the exchange coverage, right? All the exchanges are open. In some cases, they're referring to them as marketplaces, just as I guess a marketing ploy of sorts. Bottom line is, even with all the computer glitches and delays and things, the exchanges are all now open. And again, anybody who wants coverage bad enough can get it. Now, on the employer side, some of you may remember that back in October, you were required for the first time to give out to all your employees an exchange notice. This is a new notice burden or requirement for employers. And basically what the exchange notice is it's a 2 or 3 page notice, depending on whether or not you as the employer offer coverage, that explains to the employee that, hey, these new insurance exchanges exist. You may be eligible for coverage there. You may be eligible for a subsidy. Here's the information, where to go if you want more, if you need more information. 800 number, website address, that kind of thing. And then if you were an employer that offers coverage, you would also include information that says, we offer coverage as well, and here's who is eligible for it. There's a model notice that you can use. It's on the U.S. Department of Labor website. If you Google Department of Labor exchange notice, it'll take you right to it. That requirement to give out that notice to your employees became effective October 1st of last year. So all employers were supposed to give that notice to everyone, every warm body, regardless of the size of your business, October 1st. And then after that date, this notice is supposed to be a new hire notice, where you would give it to an employee within 14 days of their date of hire. So you want to work it into your new hire package of documents that you're giving out to employees. Now, if for some reason you didn't get the notice out in October because this is the first you've heard of it, I wouldn't lose too much sleep over that. As of now, there's no specific penalty that can be assessed against you for not giving the notice out, but I would encourage you to go ahead and get it out to your entire workforce, and then after that point, work it into your new hire package going forward. So that's an example of, and you're going to hear me talk about some other notice requirements that healthcare reform places on you as employers, but that's one of them. Okay, moving right along. The 90-day waiting period. So for those of you who do offer plans to your employees, starting this year when the plan renews, a lot of you, if you have plans, probably renews January 1. It's just a calendar year plan, but some employers have renewal dates throughout the year. Basically, the first renewal date this year, your plan cannot have a waiting period of any more than 90 days. So somebody comes to work for you, they're a full-time person in an eligible class, you can't make them wait not more than 90 days to get their coverage. Now, the quirk with this is that IRS has been asked several times, and every time they say 90 days means 90 days. It doesn't mean 90 days or first of the month following 90 days of employment, because that's a pretty common practice for a lot of employers with insurance. Insurance usually begins on the first of a month. It's very rare that you would enroll somebody in an insurance plan mid-month. So if you've had an introductory period or a waiting period, whatever you want to call it, that was first of the month following 90 days, that's not going to work because that's not 90 days. So what most employers have done is they've switched to a first of the month following 60 days of employment, because that's really the only way you're going to guarantee yourself that you'll always be within that 90-day cap. So again, if you do offer a plan to your employees, and you've had a longer period, I mean, it wasn't unusual to see 6-month waiting periods, for example. You're going to want to make sure that you get that changed when the plan renews this year. Question?
I thought that if someone had a variable work schedule, you could actually wait a year to see if they made the hours.
Yeah, so that's the question is, what about variable hours and variable hour employees and waiting to see a year? That's a question of whether or not they're in an eligible class, and we're going to get to that a little later. The 90-day period is, okay, somebody's in an eligible class, how long can you simply just make them wait as an administrative matter before they can sign up? Okay, so we'll get to that variable hour concept in a minute. Now, I have a lot of clients who have a 90-day introductory period or a 90-day waiting period that they use for all sorts of things. You have to work for us. Maybe you'll define the first 90 days of employment as an introductory period. You may or may not make it through that period. If we decide things aren't working out, you'll separate at some point during that point. Or you have to wait 90 days before you get vacation time or sick time, all these other things that you as the employer control. This 90-day waiting period doesn't dictate what you do for all those other things. It's still okay to have, maybe you have a 6-month introductory period for all these other things. You just have to make sure that you're carving out medical benefits and applying this new 90-day period. So, like, for example, for those of you who have employee handbooks, it's not uncommon to say, well, there's an introductory period of 6 months and nobody gets benefits until they make it through that introductory period. Well, that wouldn't be true anymore now that you have to give people who are eligible benefits after 90 days. So if you do have those kind of provisions out there, just be mindful that you may have to tweak the language.
And when you say medical, we're strictly talking the health care piece, not dental coverage.
That's right. This 90-day waiting period only applies to major medical, group health, not to dental and vision and other types of insurance benefits. That's right. Okay. The next few things are things that you would see that are impacting your plans themselves. So this is for the employers that do have plans in place. Starting this year, no plan can have a pre-existing condition limitation. I mean, this is one of the hallmarks of healthcare reform, this idea that you can get anything covered right away. You could hire a new employee who's in the middle of cancer treatments, and as soon as they get in your plan, they're going to get coverage for those treatments right away. No longer are people having to wait 6 months, a year, or whatever to get pre-existing conditions covered. So you'll see that in your plans if it wasn't already there. We have this new concept of essential health benefits, where we have the federal government and the states basically setting the menu of benefits that all insurance plans and policies need to cover. This is new, right? It used to be a business decision for the insurance carrier or the employer with a self-funded plan to decide what they were going to cover. Now we have this concept of kind of mandated essential health benefits. Now most of the stuff that you see there as essential health benefits, it varies by state, is stuff that you would expect to see in a typical health plan. But I'll give you one example, which was kind of a surprise for a lot of folks. Included in these essential health benefits is pediatric dental care. Now, it used to be that all major medical plans had very broad exclusions for any type of dental care, right? If you need dental care, you buy dental insurance. It's a completely separate concept. Well, the government decided that pediatric dental care is important to overall general health for children, and so they made that part of the list of essential health benefits. So for those of you who have plans, you may see, starting this year, things like pediatric dental care being added to the coverage, and that's because of these new essential health benefit rules.
Is it true that if the plan has over 100 employees, they don't have to add the dental?
That's correct. There are limitations on this, and this actually depends on the state. But in some states, if you have what's called a large group plan, which generally means you have 100 or more employees, the carriers are not required in some cases to cover all of the essential health benefits. But any plan that's a small group plan, which is generally, again, going to be under 100, is required to cover every single one of the essential health benefits. All right. Prohibitions on annual limits. It used to be fairly common in insurance plans to have annual limits on certain types of benefits. So sure, you can get chiropractic coverage, for example, but we'll only cover up to $5,000 or something like that. Starting this year, no plan is permitted to have an annual dollar limit on any benefit that's an essential health benefit, regardless of the size of the plan. So you may see that in your plan as well. There are cost sharing and deductible limits. It used to be, again, kind of a business decision between the carrier and the employer to decide where to set deductibles, where to set sort of maximum out-of-pocket costs in plans and policies. And there still is some room to make business decisions, but there are overall caps now in what a plan can impose as an out-of-pocket cost. If you think about it, healthcare reform steps in and requires insurance carriers to cover lots of new things that they didn't cover before. Well, there wouldn't be much teeth in that if the carriers, could just say, fine, we'll cover it, but it's out of pocket, up through $25,000 a year or something, right? It wouldn't really mean much. So the way that they addressed that was having these cost-sharing limits. Lots of new fees that are being imposed by healthcare reform. Most of those fees are imposed on health insurance carriers. So we have carriers having to contribute to a fund to basically ease the burden on other carriers who may have unhealthier populations. This is the so-called PCORI fee. There are per head fees that are basically taxes at the end of the day. They call them fees, but they're taxes on insurance carriers to help fund some of the healthcare reform initiatives. Now, what do you think happens when your health insurance carrier has a new fee or tax that it has to pay per head, right? It gets passed right down through. You can rest assured it's not coming out of their profits, all right? So you're going to see that. I mean, there's no question anymore why health insurance rates are going up. And I've actually seen some carriers, when they issue their renewal, you'll see like a 30% increase for next year. And some of them have actually been breaking that out and saying, don't blame us, blame the government. 10% is for this and 5% is for that, that kind of thing. So all of this stuff, of course, is adding to the cost of healthcare coverage. Wellness programs, a lot of employers have wellness programs trying to encourage employees to engage in certain types of behavior. Probably the most common one is smoking, big anti-smoking movement. And some carriers, some employers are having different rates. If you smoke, you're going to pay a higher rate than if you don't smoke. Sort of like life insurance has been doing for a lot of years. Lots of new rules that healthcare reform puts in place to kind of regulate those types of programs, if that's something that you do. and that's all of those start this year as well. Okay, that was kind of a laundry list of all the new things for 2014 that are coming to pass. I think it's worth mentioning why we're convened here, some of the things that have been in place for a number of years now, just as sort of a reminder that these are things that as employers you need to keep in mind. First of all, if you go all the way back to the beginning in 2010 when healthcare reform was first passed, most of what we were talking about were what I would call coverage mandates, new requirements of things that you had to cover in plans. One of the big ones was the requirement to cover dependents up to age 26, adult dependents. Some of you may remember that. We also had a requirement fairly early on to cover preventative care at 100%, so that if you went for your annual physical or for a flu shot or a vaccine, you wouldn't pay that $20 copay or whatever it is. The idea being that they wanted to encourage people to do those preventative services and take away the last cost burden associated with that. All of that stuff's still in place. The delay of the mandate did not affect any of those coverage mandates that have been in place for a while. There's a rule in healthcare reform, it's called the medical loss ratio, that basically caps the profits of insurance carriers. It says that carriers have to spend a certain percentage of the premiums they collect on benefits. And if they don't spend enough on benefits, they have to rebate amounts to their policyholders to bring those ratios in line. So what we've seen is a lot of employers that have plans are getting annual rebate checks from the insurance carrier. Usually these rebates come out in late summer, early fall. Some of you may have received those. And what happens is you get a check. It's written out to you, the employer, as the policyholder. And of course, it's natural for most employers when they get a check to say, well, great, that's our money. Put it in the general account and sort of move on from there. Unfortunately, it's not that simple. Any type of employer-based plan, particularly when employees are contributing towards the cost of the coverage, if you get a rebate from the carrier, the law says that you have to treat that money not as your own, but as a plan asset. It's something that belongs to the plan, almost if you think of the plan as an entity unto itself. And so if you're getting these rebate checks and you have employees paying for a part of the cost of coverage, in all likelihood you're going to need to spend some or all of that money for the benefit of employees. And so what most employers are doing is they're taking that rebate money and basically giving employees a premium discount or a premium holiday for some period of time in order to absorb the money. And that way they will have used that money for the benefit of the employees, and they won't have to worry about engaging in what's called a prohibited transaction, where an employer would be basically taking assets from the plan and using it on its own. So if you have an insurance plan and you're getting those rebate checks, just know that depending on how your plan is structured, you may have to spend that money basically for the benefit of the employees as opposed to using it for the employer. Small business tax credits. Since the beginning, there has been a tax credit available to smaller employers to help pay for the cost of coverage. It's very limited. You have to meet some pretty rigid requirements. The basic requirements are you have to be a small employer, which means you have 25 or fewer employees. Your average wages for your group have to be $50,000 or less. And the plan that you offer to your employees has to be subsidized at least 50%. So you, the employer, are covering at least 50% of the cost of coverage. If you fit into that, you may be eligible for a tax credit from the federal government to help cover part of the cost. For those of you who meet those parameters, if you haven't already done so, I would encourage you to talk to your tax advisor and make sure they're checking to see if you qualify for the tax credit. Starting this year in 2014, there's an additional requirement that in order to get the tax credit, you have to buy your coverage through what they call the shop exchange, which is an insurance exchange for small employers. So you'd actually have to buy your coverage through that exchange instead of through other channels, through your broker, however else you're buying your coverage. So just know that that's a new requirement for 2014. But if you fit into those parameters, make sure you talk to your tax advisor about that and see if you qualify for the credit. Question?
Is the shop exchange a federal program?
Yes, you don't hear much about the shop exchange, and that's because you think the glitches have been bad on the individual exchange. You should see the shop exchange. Where they ended up with the shop exchange is they did not have the ability to have employers sign up electronically. So it's a 100% paper process, and it was really slow to get going. But it's not just the federal. Some states have started their own shop exchanges, but if you don't have a state shop exchange, it's just like the individual coverage. You can use the federal shop exchange. But what you'll find, again, is that it's in large part a paper process, particularly with the federal exchange. And again, not a lot there hasn't been as much press coverage about it. Part of that's because, frankly, I don't think a lot of employers are using it just yet. But the hope is in the future that it's going to become a bigger source of coverage for smaller employers. Okay, W-2 reporting. There's a requirement in healthcare reform, and it didn't kick in until the 2012 W-2s, that says that you as the employer need to report as an information item on the W-2 what the cost of providing group health coverage is for your employees. And there's been a little confusion on this. One point of confusion is a lot of folks said, well, wait a minute, they're going to put this on the W-2, that means they're taxing the coverage. No, that's not the case. This is just one of those informational items that goes down in box 12, I think it is, with a little letter next to it so you know what it is. It's not pulling those amounts into the taxable box 1 wages. It's just an information item. There's also been some confusion about what do we report. Let's say we spend $1,000 a month for family coverage for an employee. We pay $500, the employee pays $500. Which number do we report? You report the total number, the $1,000. And the reason for that is the whole purpose of this is for the government to start collecting data on how much people are spending on coverage when they're buying it through their employer. There's no other way for the government to get this information because it's a non-taxable item. It doesn't show up anywhere. So this is the beginnings of the feds starting to collect that data. Now, of course, the conspiracy theory is this is just one step towards them deciding to tax it, right? As soon as they know how much it is, well, then they can evaluate whether to tax it and bump it into the box 1 wages. And certainly that may be true, but that would actually take an act of Congress. They'd have to amend the law to make it taxable. For now, it's just an informational item. In case anybody's sweating this right now, there's a current regulatory exception that says if in the prior year you issued fewer than 250 W-2s, you're exempt. It's a voluntary information reporting. So for those of you who haven't thought about this before or you're hearing it for the first time, it may be because you issue fewer than 250 W-2s each year and therefore you fit into this exemption. Now, I'll tell you that's a temporary exemption, and I expect as we get into the future, they're going to ratchet it down, and eventually all employers will have to do this. But if you're under the 250 mark, again, looking back to the prior years, and don't think of this as you have 250 employees. It's 250 W-2s, all right? So you could have 100 employees and a lot of turnover and end up issuing 250 W-2s. So keep that in mind. But in any event, if you have to do it, it's something where you got to collect that data throughout the year so you can get it plugged into your payroll system or your payroll provider and get it onto the W-2s. So that's something you need to be mindful of if you don't fit into that exception. For those of you who offer coverage, there's another disclosure requirement that healthcare reform has for you, and that's to give out these, they call them SBCs, or summaries of benefits and coverage. This is it's a 4-page uniform front and back document where the insurance carrier plugs in bits of data about your plan. What's the deductible? What's the out-of-pocket maximum? Which benefits are covered? Things like that. the theory behind these SBCs is that if every plan has to provide this information in the same format, that will allow somebody to sit down and compare apples to apples, right? You get the one from your spouse's employer, you get the one from your employer, and all the information is in the same box, so you can kind of go through and compare information. These new SBCs are required to be given out at each open enrollment when people sign up, and also when you get a new employee who comes on board and they get an offer of coverage. Now, the reason why I really like to mention this when I'm talking to employers is this disclosure obligation has what I call a hammer penalty associated with it. The statute says that if an employer fails to give out this notice at open enrollment or to a new employee, the penalty for not doing that is $1,000 per occurrence. So, you got 100 employees and nobody told you about this, your carrier didn't bother to give you the document, you don't get it out at open enrollment, in theory you have $100,000 in penalty exposure for not giving out this notice. So just make sure that most of you, if you have plans, probably have fully insured plans with a carrier. Make sure you ask your broker or your carrier to get you these notices so you can get them out as part of your enrollment process, because I have found that sometimes the carriers just sit back and wait for you to ask, and if you don't ask, they don't give you the documents. All right, I see this fall through the cracks a lot with employers, so make sure that you're on top of that if you have a plan. And then we already talked about the employer exchange notice. This is that model notice from the DOL that you're going to give out. And the difference between the SBC and the SBC only goes to folks who are eligible for your plan if you have a plan. That exchange notice goes out to everybody, every warm body. If you have 2 employees, you got to give it out to both of them. Doesn't matter if you have a plan or